Hi, I'm Leroy.
And I'm Kevin.
And we are the IT department.
And this is our day in the life.
So my name's Leroy Adamson-Parks. I'm the IT director here at the Trust. We've gone through a strengthening of our team in the last 12 months, and we've created two very distinct teams. We've got a team that covers programmes and projects, which is headed up by a deputy director by the name of Andrew Carson. And we've got a deputy director of IT who runs the day-to-day operations, and that's Kevin. So I'll let Kevin introduce himself.
Okay, thank you. So Kevin Houghton, deputy director of IT. So as Leroy said, I run the operational teams within the Trust. Joined this Trust in October of last year, so just a couple of months before Christmas. For about 10-11 years experience in the NHS at different trusts, so familiar with some of the challenges we get. And then, as Leroy said there, the team had a restructure last year, so I'm managing all of the operational teams there, from the service desk, infrastructure, cybersecurity, clinical applications, telecoms, desktop servers, all of those kind of things. Okay, 1 and 2. Okay, this one says, what's one of the biggest challenges your team have overcome? Ooh, okay. Well, I guess currently, during the pandemic and when we had the peak in about January, the Trust itself was obviously starting to ramp up the vaccinations, and a lot of the team was supporting a lot of the additional vaccinators, for example, that were brought into the Trust. So it was doing the additional support plus our normal day jobs whilst working in this current climate as well, because we have to consider staff that had to shield and all of the other issues that we had, whilst trying to give the best service to all of the staff within the Trust.
How do you support each other in your team? Well, that's a really interesting question. We've got a number of different teams within the IT department. And I've explained previously about Kevin's role and Andrew's role as Deputy Director, leading on programmes and projects. Each team, they've got their own ways of doing things and skills, and we'll show you when we go up to the projects room later. They tend to have a really good banter going on. They're constantly testing ideas out with each other, sharing contacts across the Trust to talk to about the things that we may need help with.
Okay, it plays a pretty big part. In fact, it's in most of the things we do, and we have to protect either patient or corporate data in all of the systems we use, and as the amount of data increases, then the level of protection needs to increase to match that as well.
If I could add to that, I think it's really important that we have a non-executive director on the board, Godfrey Allen, who is a cybersecurity non-executive. He's been supporting us in that area and being, in effect, the voice of the patient for the last 12 to 18 months. So it's a good opportunity for someone to reflect back to us the impact of what we're trying to do as a trust from a patient or a staff member's perspective.
Okay, would you like to follow me? Hi Lucy, got some people to meet you. You can just introduce yourself.
Yep, hi there, I'm Lucy Helen, I'm the IT Service Desk Manager. I manage the Service Desk, who are the first point of contact for all IT issues. Our mission is to always provide excellent IT support to all staff, enabling them to provide excellent care for the people in Croydon.
So Lucy's explained to you that sometimes we are asked for support by the Trust to implement a new system or provide an upgrade to a current system that we've got in place at the moment. So what we tend to do at that point then is we collect all of those requests and put them in, we call it a queue, so it's a list of requests for project support. So we'll assess each request for support and identify whether it's a relatively quick or small piece of work or something that's maybe a bit more detailed that needs different expertise from the team, maybe technical, maybe understanding how the service works. And that's where we hand over to the projects team, who are a team with some of those areas of expertise, who then go and talk to the person asking for support to see what it is they need from us. So I'll hand over to Camelia.
Hi, I'm Camelia Singh. I'm Senior IT Project Manager here at Croydon, and I'm working on quite a few projects. One of them just completed was the new intranet project. We're a reasonably sized PMO, there's 7 of us in here. We're all very, very busy, and yeah, we're out and about supporting everybody in the trust, getting hold of new projects at the beginning, trying to steer people in the right way, looking through the governance of the projects, helping with our processes and standards.
So Richard's responsible for managing a team that covers a desktop support team that fix your computers or printers as and when they need fixing. We've got an infrastructure team that manages the servers to make sure they are well structured, they've got a standard configuration, their data is held on them safely and securely. And he's also got a telecoms team. You'll know we've got hundreds of mobile devices that we use as a trust, as well as the desktop phones that our staff use day to day. So we need to make sure those systems are up to date. We know who's using those systems, we know who's got one of those devices, because security is absolutely critical as well, and a part of Richard's role for the organisation. I've forgotten what the question was now. Goodness.